Thanks for staying with us. That was today's briefing by members of the PTF on COVID-19. Moving on now, the COVID-19, President Muhammad Buhari's third broadcast on COVID-19 has been described as reflective of the president's concern with what Nigerians are going through in the face of the pandemic and the challenges arising from the subsequent lockdown. Public affairs analyst Hamid Sojo, commenting on the president's broadcast on Good Morning Nigeria, also described the presidential directive for total lockdown of Kano as a right step in the right direction.
It's in their own interest, like I said, if you look at the index cases, the index case in my state, for example, of Adamawa, was somebody who traveled from Kano. The index case in Gombe, the index cases in Gombe also traveled from Kano. Certain index cases in northern states were people who traveled from Kano. Kano people must realize that they're not just protecting themselves, but they are protecting the entire north and even beyond. And so it's in the interest of the people of Kano to actually comply.
Advised state governors to monitor compliance with the lockdown order in the respective states in order to facilitate a planned easing of lockdown from May 3rd towards gradual restoration of economic activities. Let's now join our correspondent Mitari Ikpen, who is at the venue of the briefing, to give us detailed highlights of today's briefing. Mitari, if you can hear me loud and clear, could you give us detailed highlights of today's briefing?
Thank you, Ruth. The Presidential Task Force on COVID-19 today indicated that they plan to relax the restriction order from the 4th of May. Does not imply the end of the pandemic in Nigeria. And Nigerians are advised to avoid non-essential interstate movement and travels so that the coronavirus will not be transmitted interstate. And again, the Presidential Task Force said it is already preparing guidelines that will guide the period of relaxation of the restriction order. A lot of Nigerians, you will agree with me, are concerned and want to know whether they will have to go to work or they will have to go to school. But the Presidential Task Force says the implementation guidelines are being drafted, and these will be made known in the coming days. Also, today, the Nigeria Center for Disease Control said it is planning to test about 2 million Nigerians in the next 3 months for the coronavirus at the ratio of about 50,000 people per state. All this is in a bid to increase testing capacity and step up the fight against the pandemic. And also, the Minister of Information and Culture, Mr. Lai Mohammed, also made us know that President Buhari, at the request of the United Nations, at America's request, briefed the President Trump, on Nigeria's response to the fight against the coronavirus. And the American president was pleased with Nigeria's fight and promised to send ventilators to assist Nigeria in its fight against the coronavirus. And just to add that the Minister of Health today said all members of the Chinese medical team in Nigeria have been tested for the second time, and they all tested negative for the coronavirus. He did not particularly indicate what they will be doing in the coming days, but he had said before now that they will be consulted for expertise to help Nigeria in the fight against the pandemic. Those are some of the highlights, Ruth.
Mitari, thank you so much for your time. Moving on now, the COVID-19 laboratory at Aminu Kano Teaching Hospital has resumed testing. A statement by the hospital officials indicates that this was due to the efforts of the joint team of the Nigerian Center for Disease Control, Aminu Kano Teaching Hospital, and other partners. Meanwhile, President Muhammad Buhari on Monday approved a phased and gradual easing of lockdown measures in the Federal Capital Territory, Lagos and Ogun states, effective Monday, 4th May 2020. Sequel to this approval, President of the ECOWAS Commission has directed that all ECOWAS offices in Abuja and Lagos should remain closed until Monday, 4th of May. Staff of ECOWAS institutions in Abuja and Lagos are therefore advised to continue working from home until further notice. President of ECOWAS Commission also encouraged staff to adhere strictly to health advisory, social distancing and other protocols placed by relevant authorities in the country. Joining me live via Skype to talk more on President Buhari's nationwide broadcast is a public affairs analyst, Mr. Jide Ojo. It's nice to have you on Nationwide.
Thanks for having me. Good evening.
I'm sure you listened to the President's broadcast yesterday. What is your assessment on this?
The President was quite on point, and he actually did speak the minds of the world, the minds of Nigerians exactly, that we cannot perpetually lock down the country in the face of pandemic. It needs to work a delicate balance between preserving lives and preserving livelihoods. So we don't want to lose life, but we also don't want to lose livelihood, because once you lose life, you are more or less losing livelihoods. So it's a delicate balance the President was trying to work, and he did say in section paragraph 44 thereabout of his speech that he has actually consulted widely the Nigerian Governors Forum, the NCDC, the Presidential Task Force, and other people who are consulted in order to come to that decision.
The federal government has graciously agreed to pay 20% of basic salary to medical personnel working directly on all COVID-19 related issues. What's your take about this?
There's no amount of incentive that is given to our health workers that will be much. This is about life and death. We've had news stories that about 40 health workers have contracted coronavirus. So in the last fortnight, what the President has done through PTF was to have 5,000 health workers insured, as well as improving the allowances and hazard allowances and other incentives for health workers. He did make that promise during his April 13 speech that he was going to be looking at the welfare of health workers. So it was a good news that the President actually honored his promise to Nigerian health workers. I do hope that this will be sustained beyond the COVID-19 period.
Looks like schools will be resuming soon. What would you like to see in place?
Yeah, that's a very apt question. I've asked myself, will I allow my son or my daughter to go to school under this kind of circumstance? We do know that currently what we're doing is to have e-learning, which these students, these pupils are not used to. Now, whether we like it or not, in due course, they have to go back to school. But what I want to see in place actually has to do with ensuring that these protocols by WHO and the Nigerian Center for Disease Control is strictly adhered to. First, I want to see every, whether public or private, having a thermometer to check the temperature of their students or pupils. 2, sanitizers. If it means every parent will have to buy sanitizer for their wards or children, let them do so. 3, there must be provision of water, because you cannot do hand washing without water. So you need to have all schools provided, if they have to be taking water tanker, if they have to go and dig borehole, if they have to go and dig well, let there be water for these students to wash at every point in time that they need to. Then the wearing of face masks has to be made compulsory. But lastly is the issue of physical distancing. We cannot afford a situation where children will be crowded in classrooms, having 40, 50 children in public schools or even private schools. This is no longer tenable. We have to maintain that physical distancing, making sure that they are not sitting too close to each other and that we don't have students learning under tree or sitting on stones and other other improvised furniture. So we need to make sure that our school system is well organized to respect all those protocols, physical distancing, sanitization, as well as wearing of face masks.
All right, Mr. Gidojo, thank you so much for your time. Thank you for sharing your thoughts with us.
Thanks for having me.
Moving on, Nasarawa State Government says it is implementing more stringent measures in tandem with federal government's directive as index case of coronavirus pandemic emerges in the state. Governor Abdullahi Sule at a meeting in Lafia identifies the first case as a female from Kano. Ali Tijani Mohammed reports.
Nasarawa State status has changed with the index case from Garaku community along Kefi Akwanga Road who returned from Kano.
So for the first time, we had a lady that tested in Kokwana and she's positive.
All contacts of the index case have been isolated while the patient is being managed at the Dalhatu Arab Specialist Hospital, Lafia. Government says 14 days of quarantine awaits anyone returning from parts of the country. The total lockdown of Karo has been extended for additional 10 days, while the 8 p.m. to 6 a.m. curfew in parts of the state is still in force.
The government is drawing the attention of us to reduce movement and traveling up and down, especially with the restriction of interstate travels.
The police and other security agencies are more now focused on how to enforce proclamations and regulations.
However, farming activities are to resume across the state, while the ban on social and religious gatherings, as well as the use of motorcycles and tricycles, are still against the directives of containing the pandemic. In Lafia, Aliu Tijan Mohammed, NTA News.
And Bayelsa State has recorded its first COVID-19 case with a female patient who tested positive last Sunday. The patient, who was presented at the Government House Hospital, has been transferred to the Niger Delta Teaching Hospital. Doris Akumoye is standing by with the reports.
The female patients at the weekend presented with symptoms of COVID-19. A sample was sent to the testing center at Ira, Edo State, reportedly returned positive. She was taken to the isolation center at the Niger Delta University Teaching Hospital, Okolobri, where she is said to be receiving treatment. Permanent Secretary, Ministry of Health, Bayelsa State, Nathaniel Akpoku, said her family members and those who came in contact with her will be tested to ascertain their status in order to reduce the spread of the virus.
There were 5 patients, who were at the specialist hospital of Bayelsa. Since the suspicion was COVID, but since then they turned out to be negative, so they had to go home. Then the other one that was positive was immediately sent to isolation center.
He called on Bayelsans not to panic as government has provided measures to curtail its spread, including 3 isolation centers provided in case of emergency. In Yenagoa, Bayelsa State, Doris Akomoye, NTA News.
The first case of COVID-19 has been reported in Kebbi State. Governor Abubakar Atiku Bagudu, who disclosed the index case, said out of 13 samples sent to the Nigerian Center for Disease Control, 1 came positive. Usman Abdullahi Shehu tells us more. We hope to bring you that report in our subsequent bulletin. Moving on, Imo State Governor Hope Uzodinma has appealed for calm as the state records index case of COVID-19, assuring that necessary steps have been taken to curtail the spread. Bright Abuja reports that the governor made this known in a broadcast to mark his 100 days in office.
In cases of COVID-19 infections in Nigeria, the Imo State government, in its effort to prevent the outbreak of the disease in the state, has taken several precautionary measures, which include total lockdown, ban on all social and religious activities, and curfew, among others. Governor Hope Uzodinma, while signing into law the bill to enforce measures to prevent and stop the spread of coronavirus, noted that the fight against COVID-19 is not an easy one. Hence, the need for cooperation from the people.
A level of first, if we don't do social distance, it is also an offense if you don't sanitize your hands. It is also an offense if you do public gathering. Also an offense if you don't comply with restriction orders. The government and the governor has been empowered by this law to invoke the penal clauses.
Speaker, Imo State House of Assembly, Chiji Collins, states that the objective of the law is to safeguard the lives of the people while ensuring that laid-down rules are adhered to.
We know that it's not enough to say that social distancing, sanitation, clean air, simple hygiene. This thing has to be backed up with legislation.
In Owerri, Bright Abuja, NTA News.
The federal government has declared Friday, May 1st, 2020 as public holiday to mark this year's International Workers' Day celebration. Minister of Interior, Ogbeni Ralph Aregbesola, who made the declaration on behalf of the federal government, commended Nigerian workers for their resilience, patience and understanding, particularly in their support of President Muhammadu Buhari's efforts at stemming the spread of COVID-19 pandemic in the country. The minister thanked Nigerians and the labor force for their sacrifices in the present period of trial, assured that their commitment and patience will complement the efforts being made by government and other stakeholders to ensure the speedy control of the virus. Senate has reconvened from its 6 weeks recess, approved 850 billion naira new plan from the international capital market as requested by President Muhammadu Buhari for financing the 2020 budget deficit. President Muhammadu Buhari also requested the confirmation of 38 nominees as chairman and members of the Federal Character Commission, 7 nominees as members of the Revenue Mobilization Allocation and Fiscal Commission, and 2 nominees as commissioners for the Federal Civil Service Commission. National Assembly correspondent Ignatius Nkwo reports that the Senate therefore commended President Muhammadu Buhari's leadership of the National Assembly, Presidential Task Force on COVID-19, health workers, and international bodies for their commitment over COVID-19 containment process. The legislators called on the executive to reorganize the national response strategy as they observed that the pandemic has provided another opportunity for the executive to restructure the Nigerian economy as restructured the Nigerian economy by appropriating 10% of gross domestic product to strategic sectors of the economy as stimulus for investment. The House of Representatives has passed for second reading the Control of Infectious Disease Bill, which seeks to empower the Niger Center for Disease Control to effectively take charge during health emergencies such as the spread of coronavirus disease. The bill seeks to repeal the current Quarantine Act in operation, which the lawmakers say is outdated and weak, thus preventing the NCDC to make the desired impact in the event of a pandemic like COVID-19, which is ravaging the world. House Speaker Femi Gbajabiamila, who sponsored the bill with 2 other members while debating the general principle, says it aims to make NCDC proactive and imposes a duty on medical practitioners to provide information of any suspected case of infectious disease to NCDC. The lawmakers, following a motion from House Leader Alhassan Ado Duguwa, urged the federal government to scale up testing capacity of COVID-19 in all states of the Federation and urgently implement the presidential directive to investigate the immediate and remote causes of unprecedented number of deaths in Kano State. Addressing the House at resumption of plenary, the Speaker, Femi Gbajabiamila, commends the federal government for setting up the Presidential Task Force on COVID-19 and describes the lockdown and curfew as necessary interventions. First Lady of Nigeria, Aisha Muhammadu Buhari, has commended the efforts of the frontline healthcare workers, especially volunteers, for their steadfastness and selfless contributions to the fight against COVID-19. The First Lady stated this in a message when she donated medical equipment to frontline healthcare workers in Abuja. State House correspondent Aliu Kabir reports.
In response to government call for the need of collective effort in fighting the spread of coronavirus, the First Lady of Nigeria has donated personal protective equipment to frontline healthcare workers who are participating voluntarily in the fight to defeat the pandemic. This decision, according to the First Lady in a message, is necessary considering the need to protect the healthcare workers who undoubtedly are the most vulnerable group in this battle. Equipment such as disposable gowns, overall suit, and disposable surgical mask were among the items donated.
We are here to present, or rather donate, personal protective equipments in the form of protective disposable gowns, N95 masks, surgical face masks, hand sanitizers, goggles, and other protective devices. We are donating to a group of professional healthcare providers who voluntarily on their own decided to advocate and solicit for support and assistance on behalf of fellow healthcare workers working in various hospitals across the country.
The founder of an NGO, Mask for Nigeria Medics, Dr. Ilham Ahmed Umar, received the items on behalf of the healthcare workers in Nigeria.
We're very thankful today. We plan on providing these PPEs that Her Excellency has provided to donate PPEs to general hospitals within Abuja. These general hospitals include Wuse District Hospital, Maitama District Hospital, Yanya, Kubwa, and Gwarimpa General Hospitals. We cannot show the amount of gratitude we have.
While promising to remain committed in supporting the government in the fight against COVID-19, the First Lady noted that the contribution has become necessary in response to a call on the need for countries to strengthen their healthcare facilities' infection prevention control measures. In Abuja, Aliu Kabir, NTA News.
And that's Nationwide Today. Thank you so much for being a part of it.